Today we are going to discuss with you guys the topic of hypertension, or otherwise known as high blood pressure. The following are important questions to know prior to going to a doctor's appointment pertaining high blood pressure. And some doctors may actually ask these questions at the appointment. So can you explain to me what blood pressure measures in the body? Blood pressure measures the force of blood that pushes against the blood vessel walls, and it is measured in millimeters of mercury. The meaning of high blood pressure is that the pressure on the arteries is higher than it should be. When a blood pressure is taken, there are two numbers. The top number is known as systolic. It measures the pressure when the heart beats. The bottom number is known as diastolic, which measures the pressure and when the heart is at rest in between the beats. A normal blood pressure reading is systolic, less than 120, and diastolic, less than 80. An elevated blood pressure reading is systolic between 120 and 129 and less than 80 diastolic. At this point, you are approaching hypertension, and you would need to make some lifestyle changes to prevent this from occurring. Stage 1 hypertension reading is systolic between 130 and 139 and diastolic between 80 and 89. At this point, you need to be seen by a healthcare provider, and he or she may place you on blood pressure medication. Stage 2 hypertension is when the systolic is 140 or higher and diastolic is 90 or higher. At this point, you also need to be seen by a healthcare provider, and he or she may place you on blood pressure medications as well. Now, do you know that hypertension is known as the silent killer? It is known as the silent killer due to most people who have high blood pressure do not have any symptoms. The signs of the disease can be deadly. High blood pressure can cause a heart attack, heart failure, or even a stroke. By knowing risk factors of developing high blood pressure and steps to lower your risks can actually save your life. The following are some risks of developing high blood pressure. An unhealthy diet, in which Candace will discuss later on in the presentation, being inactive, having obesity, drinking large amounts of alcohol, using tobacco, genetics. Any individual that is 40 years or older who has high risks of developing high blood pressure should have your blood pressure read every year. The following are some symptoms of hypertension. Like I mentioned above, most individuals do not experience symptoms, but ones who actually do have high blood pressure, they may experience a headache, shortness of breath, or nosebleed. Most of the high blood pressure patients, the blood pressure doesn't actually cause the headache or nosebleed. It will eventually lead to that in something called hypertensive crisis, which is a medical emergency. A blood pressure reading of a patient going into hypertensive crisis would be 180 over 120 or higher. Blood spots in the eyes, facial flushing, or dizziness can be seen in individuals who have high blood pressure, but it is not definitive that these are symptoms of high blood pressure. These could be complications that can occur from high blood pressure medication, or if it's uncontrolled high blood pressure that is leading to a worse complication. The importance of drug compliance for patients who have high blood pressure is important. The medication is used to try to bring the high blood pressure back down to a normal range. The higher the blood pressure reading is, the higher chance the patient is of a risk of a stroke or other complications. Some people may think that if their high blood pressure returns to a normal reading, they can actually stop their blood pressure medication. But the reason it is normal is because of the medication. The medication is actually working as it should. If you stop taking your medication, it will cause your blood pressure to rise again, and this could place you at a risk of a stroke. If you are experiencing side effects of medication that is unpleasant, you need to discuss this with your healthcare provider, and he or she can adjust your dosage or actually change the medication. If the cost of the current medication that you are taking is an issue and you cannot afford it, You also need to discuss this with your primary care provider. That way he or she can either prescribe you a different form of the medication. If you are forgetful and you forget to take your high blood pressure medication, you could purchase a pill box that is marked with the days of the week. This way you can put all your medications in one little slot and take them each every day. You must talk to your doctor before you stop your high blood pressure medication for any reason, or if you have any concerns regarding your medication. At this time, Candace is going to discuss lifestyle changes or modifications that you can do.
So today I'm going to talk to you about nutrition and healthy eating and what we call the DASH diet. So DASH stands for Dietary Approaches to Stop Hypertension. The DASH diet is a lifelong approach to healthy eating that's designed to help treat or prevent high blood pressure or hypertension. It was actually developed by the National Institute of Health to lower blood pressure without medication, and it's been researched and sponsored by the National Institute of Health. So the DASH diet encourages you to reduce the sodium in your diet and eat a variety of foods rich in nutrients to help lower your blood pressure. Some of these nutrients include potassium, calcium, and magnesium. There are two different types of the DASH diet. The first one is the standard DASH diet, which allows you to consume up to 2,300 milligrams of sodium each day. And the second one is lower sodium DASH diet, and it has a restriction. You can consume up to 1,500 milligrams of sodium each day. Both versions of the DASH diet include lots of whole grains, fruits, vegetables, and low-fat dairy products. The DASH diet also includes some fish, poultry, and legumes, and encourages a small amount of nuts and seeds a few times each week. You can still eat red meat, sweets, and fats just in small amounts. The DASH diet is low in saturated fat, trans fat, and total fat. Some examples of each of the food groups that we can eat with the DASH diet. For grains, this includes whole grains such as bread, cereal, rice, and pasta. They recommend 1 slice of whole wheat bread, an ounce of dry cereal, or even half a cup of cooked cereal, rice, or pasta. Grains are naturally low in fat, and we can keep them this way by avoiding butter, cream, or cheese sauces. Some examples of vegetables for the DASH diet includes tomatoes, carrots, broccoli, sweet potatoes, and other vegetables that are full of fiber, like greens and raw leafy green vegetables. These have minerals such as potassium and magnesium in them. And don't think of them as just side dishes. Let's see. An example of fresh fruits, 4 to 5 servings a day. Many fruits need a little bit of preparation to be part of a healthy meal or snack. Examples of these include canned fruit, fresh or frozen fruit, grapefruit, and citrus fruits can also interact with certain medicines. So check with your doctor or your primary care provider to make sure it's okay before you ingest grapefruit or citrus fruits. With dairy, milk, yogurt, cheese, and other dairy products are a major source of calcium, vitamin D, and protein. The key is to make sure you choose dairy products that are low fat or fat free. Otherwise, they can be counted as a major source of fat intake. Lean meat, poultry, and fish. Meat can be rich in protein, vitamin B, iron, and zinc. Choose a lean variety and aim to no more than 6 1-ounce servings a day. Cutting back on your meat portion will also allow room for more vegetables. Fats and oils. Fat helps your body absorb essential vitamins, and it also helps your body's immune system. But too much fat increases your risk for heart disease, diabetes, and obesity. Less than 30% of your daily calories need to come from fat, with a focus on healthier, non-saturated fats. Drinking too much alcohol can also increase your blood pressure. The Dietary Guidelines for Americans recommends that men limit their alcohol to no more than 2 drinks a day, and women to 1 or less drink a day. Foods at the core of the DASH diet are naturally low in sodium, so just by following the DASH diet, you're likely to reduce your sodium intake. You can also reduce your sodium further whenever you're cooking. Use sodium-free spices or flavorings with your food instead of salt. Don't add salt when you're cooking, rinsing your canned foods to remove some of the excess salt, and buying foods labeled with no salt added, sodium-free, low sodium, or very low sodium on the labels. Some other tips to help ease your way into the DASH diet is to change gradually. Rather than switching immediately, take 1 or 2 pieces at a time and change over a few weeks. Reward successes and forgive slip-ups. It's okay if you have more than sweets than you need in one day. Just try and make up for it the next day. Add physical activity and get support if you need it. If you're having problems sticking with your diet, talk to your primary care provider about how to eat better and stay healthy. Next, Miranda is going to talk to us about how to correctly take your blood pressure.
Okay, so we're going to talk about the right way to take your blood pressure. There's 2 different ways your blood pressure can be taken. There's the automatic cuff, and then there's the manual cuff. The manual cuff is the one that's most likely going to be used at your doctor's office. It's when they have the bulb that pumps the cuff up. And the automatic one is one that would be best for everyone to keep at home to take their blood pressure when they feel like they need to. It would be the easiest way to take your blood pressure. You must sit in a chair with your feet flat on the ground, and the arm that will be used for the reading must be supported so your elbow is heart level. The cuff should cover 80% of your upper arm and should be placed on bare skin, not over a shirt. And you should not talk during the measurement. So now we're going to show you how to properly take your blood pressure. And in your pamphlet, you'll see a demonstration of the correct way to take your blood pressure. She's going to take her jacket off because we shouldn't do it on top of any type of clothing. Her arm is at heart level. We'll slide the cuff on. It should fit firmly. You don't want it to be loose. And like we said, you don't want to talk. Your feet should be flat on the floor. Your back should be supported. Before you even sit down to take the reading, you shouldn't have any food or drink for 30 minutes, and you should make sure your bladder is empty before you begin. So LMA's blood pressure is 108/78, which is a good reading for a blood pressure.
So included in your pamphlet that we're giving you guys, it does have the example of how to take your blood pressure the correct way. It does have an example of the DASH diet, and it has examples of what high, medium, and low blood pressure are, or normal blood pressure are, excuse me. If you're experiencing high blood pressure, please speak with your primary care provider about blood pressure management. Proper diet and exercise can help reduce your risk of developing high blood pressure. Correct measurement of blood pressure is important, And knowing the difference between high blood pressure, low blood pressure, and normal blood pressure readings can actually save your